Good morning.
Good morning.
Good morning, Ambassador Birx. Debbie, you have been, you've been in a pivotal role. You've been in the fight against HIV/AIDS from basically the beginning. You currently oversee implementation of PEPFAR and the U.S. government engagement with the Global Fund. You have a 3-decade career. You started at DOD in '85.
Making me sound really old, so thank you.
But I want to just as a framing question this morning, just to start, to ask you to take a step back and tell us, where do you think we are in this battle? What stage of this battle are we in? Are we on offense? Are we on defense? And how would you characterize the stage of the fight?
You know, it really depends on what you're willing to accept. So I think there are people today who look at the epidemic in the United States stagnant around 38 to 39,000 new infections a year and say, okay, well, that's a plateau. I don't know if that's winning. I don't know if that's offense or defense. I think globally, we find a whole series of countries where when we work together, starting at the community, and then we get governments to adopt the policies that make our U.S. taxpayer dollars work, we made tremendous progress. So when you look at a country like Ethiopia, very low incidence, incredible drop in the rate of new infections. And then you look in West and West Central Africa, where I think we're still very much on defense. So I'm glad for the question, because that's how I think about this. I think, where are we making extraordinary progress, and how do we do more of that? And what are we going to accept as the plateau, or what are we going to accept as a rate of new infections? And then I see whole countries where we're still on defense. I would say in every country in the world that has primarily a key population-driven epidemic, we're still incredibly on defense. And I think that's a lesson to all of us. What are we missing? What are the social determinants of that? What are we doing wrong? And I think you said earlier I have a sunny disposition, and that's sort of right. If you ask the people that work with me every day, they would say, because we're very much driven to figure out every day what we are doing wrong so we can fix it.
Yeah.
So we're not always on defense.
So let's talk about PEPFAR. You have congratulations on a 15th anniversary and a pretty enormous record of success over those 15 years in getting folks treatment. You've just announced a new strategy to govern the next 3 years. And what do you think are the biggest changes that are reflected in that strategy?
Well, I think I'm really excited that we're at 15 years, because I think it really reflects on the fact that that's through 3 administrations.
Yeah.
Through Republicans, Democrats, Republicans, 8 Congresses with different parties in control. And I think it really speaks to the fact that we still have people that understand the program and want to support the program. And so when I look at now where we are and where we could be, making sure that we're evolving the program every day to really speak to what the issues are, and they change every day. When the epidemic switches into the next generation has a very different view of HIV/AIDS. The generation coming of age now in Africa, coming of age in America, they haven't experienced a time when there wasn't HIV/AIDS. So they have a very different acceptance of HIV/AIDS in their community. And I think we still rail against it and still believe that we have to really get this to a place where it's not affecting people anymore.
How do you think that shift, how does that play into the work that you and your teams are doing every day?
I think when we saw the epidemic shift in the United States, and I started domestically, I started in the Department of Defense at Walter Reed, not far from here. And we were really ground zero of the epidemic. We were confronted by soldiers dying in their 30s. And you think you are so well trained as a physician, and you think you're so smart in your 20s, and you think you can do anything, and then all of your patients are dying. And I think it was such a humbling wake-up call for us. And I think while our patients were dying, other people who were dying were going to the streets to demand something better, knowing they were dying themselves. And in the moment of fatigue and death, they spoke for others when they knew there was going to be nothing for them. So I think all of us that experienced that are motivated out of that depth of understanding of the sacrifice. World AIDS Day was created out of sacrifice. The sacrifice that others made so that others could live today. The sacrifice of the people who went to the FDA, who went to the NIH and demanded better research, better drugs. The pharmaceutical companies and making those drugs available. So I think there's so much sacrifice in the field. You have to be motivated every day to change that. The next generation doesn't see that often, that level of sacrifice. And so there's a more level of acceptance. And so we really are working with the public-private partnerships, private sector, who understands how to sell things, to really understand how to get messages to 15-year-olds that resonate, to 20-year-olds that resonate. I have to say, having raised two daughters that are now in their 30s, and I find out what was happening in their teenage years, I was not an effective communicator. So I understand that about myself. So I'm willing to get help from people who really understand how to create messages that are relevant to people's lives so they can understand and accept and then utilize that information as power in their own lives.
To look ahead to the next 15 years, 15 years from now, we will be past UNAIDS deadline for eradicating HIV, or the goal of eradicating HIV by 2030. How realistic, based on where we are right now, how realistic do you think that goal is?
Well, elimination and eradication really depends on having a vaccine and a cure. And I want to applaud the administration and the Congress to continue to invest in a vaccine and a cure, because those are absolutely critical. We're making progress in vaccines. I'm really excited about the trials that are going on. So you have to really believe you're going to have a vaccine and a cure, because what we're doing in PEPFAR is we can decrease incidence. We can stop new infections as best we can, and we're making tremendous progress there. But we still will have 37 million people HIV positive who need to stay on their medication until we have a cure. Yeah. So I think I never talk about elimination or eradication. I talk about how do we get to the lowest number of new infections so that we create a space for the vaccines and a cure with saving as many lives as we can by preventing new infections. So I think that's where we are. We really understand the reality of it, but we are very confident in Tony Fauci and his ability to work with brilliant investigators in the United States and multiple universities to make a vaccine and cure happen.
Yeah, you've been, I should know, engaged even in that part of the work for much of your career.
That was exciting. I was with my little hood. Your hood and your T cells don't speak back to you. It's a very calming place.
But one of the key several folks have sounded recently a note of alarm about where we are, even in the quest to get to a vaccine, because one of the things that we'll need to get there is funding. I think a lot of observers were struck by the proposed cuts to PEPFAR in the White House's last proposed budget, given the record of success through 3 administrations. How do you think the funding, the status of funding, especially here in the U.S., where how the signals that we send about our commitment to this cause have significant ripple effects throughout the world? How secure do you feel about the commitment to continue funding this disease and get the funding to where it needs to be to get to a vaccine?
I feel very secure because I came out of the military. So when someone doesn't like your program, you don't get cut, you get zeroed. So to me, having a budget cut, and let's put that into a frame, when you're talking about $1 billion out of $6 billion, you're talking maybe a 15% cut. So in my mind, that was a wake-up call to all of us, that PEPFAR, like many of our infectious disease programs, even in the name, has the name emergency. And we should every day be saying, what does it look like and what's it going to take to get to a much lower rate of infection that's affordable by the countries, affordable by the ministries of finance? How do we get to that level? And how do we create a program that's more and more cost efficient and cost effective? And so I think, and I'm sure we have some PEPFAR partners out there who will tell you, we look at data quarterly. We're looking at down to the penny of what you're spending to achieve the results. And we're really asking ourselves every day, we could save more lives if you become a little bit more efficient and effective. And so I think when people focus on resources, to my mind, it was saying, are we confident that our foreign assistance program are as effective and efficient in having the outcomes and impacts that they were designed to have? And I think anybody who runs a big program can't answer that yes.
Yeah.
They need to answer it, I don't know, and then get the information to be able to prove to the administration or Congress. I think we're in a position now where we're proving that. And I think it's really important to see how countries, I just want to be very clear, South Africa is funding 80% of their response. Namibia, 65% of their response. Botswana, 75% of their response. Eswatini, over 50% of their response. The Ukraine, Vietnam, country after country that we work in the last 5 years have dramatically increased their investment to protect their own citizens and provide treatment. So we see this as very optimistic of where countries are going, where there'll be countries that have a substantial epidemic, that don't have commodities, that don't have the ability to really make it into middle income status. Yes. And are we still going to be there? Yes.
UNAIDS estimates that we're funding at about half the level that we need to globally to get to that 2030 goal currently. Do you think that we can make up that short? Do you think that that estimate, that if we were to focus more on cost effectiveness in the approaches that we're taking, that we would get a lot closer to that goal?
First, I would never disagree with UNAIDS because I think they have been, we are so, I mean, we kind of skip over that, but the reason we know precisely where we are and where we are in offense and where we are in defense is because of UNAIDS. They have been working with countries since the beginning of the epidemic to get this information for us. We are blessed to have that level of detail and information. But we have to ask, what went into that equation? Well, a lot of our numbers went into that equation. Before we developed this really intense partner monitoring, before we were moving to indigenous partners without indirects, you know, all of these things that are happening that we're really pushing for a sustainable program, preparing ourselves to be Ethiopia and Cambodia everywhere. And really understanding what that looks like. And so I don't ever look at resources as being a barrier. I look at resources, you should never use that as an excuse for not doing everything that you can. And sometimes our answers are, we just need more money. I don't find that that's ever the answer. I find there's always a way to make your money. And I guess I feel responsible. My parents are 90 and 94. They're still paying taxes. I have to go to them and be able to say, I'm using your money, the money that you don't have and you're paying into taxes in the most effective way that I can. And I think we are getting there. And I think we're so proud of the teams. We're so proud of the countries and the partners and the progress they've made. When you look at our data, you can see in the last 5 years, we've doubled the number of people on treatment. Almost 19 million circumcisions. That has quadrupled. That's prevention for young men. We did all of that in a flat budget. So we're not about making excuses. We're about finding solutions.
Yeah. I have many more questions to ask you, but I'm going to ask just one more before I give our audience an opportunity to ask some. And it's about your concerns. If money is not your main worry, and those resources aren't your main worry at this moment, I'm curious, Dr. Mark Dybel, one of the founding architects of PEPFAR, recently said, we are, in my view, in the highest risk ever of losing control of the epidemic since all of this began. So I think that there are a lot of folks that are really concerned that while we've kind of told a victorious we shall overcome narrative about HIV/AIDS, that as a matter of fact that there are huge dangers potentially that lie ahead. So what worries you most? What are your biggest concerns?
First, Mark is brilliant, so I don't ever want to disagree with him. I also want to say I never like fatalism in a disease. I think it's appropriate always to put out warnings, but when you put out a warning, come back immediately with a solution that says if we do these 3 things, we're not going there. What worries me the most is countries that continue to have barriers to access to services, whether that's a key population, whether it's a young person. I mean, Mark is right. The epidemic is moving into this demographic youth bulge that is extraordinary in sub-Saharan Africa, twice as many 15 to 24-year-olds. That is our job to figure out how to reach them with solutions that really ensure that they don't become infected. So I worry every day about governments not adopting the right policies to make our money work, not adopting the right policies to make global fund money work. We should not still be sitting here talking about countries that have less than 50% coverage for their people who need treatment because there is stigma and discrimination 30 years into World AIDS Day. You said it started in 98. Why are we still talking about people not being accepted in their communities? So the fact that we're still having barriers to access, it gets into that. And I will never say that we have adequate resources everywhere around the globe, but I will say now we're coming to global fund replenishment, we should be pushing France, Germany, the UK, all of the countries. The United States has not been able to make its full replenishment commitment because we give 2 to 1, and they haven't made enough. The other donors haven't put in enough money. So I say, donors, step up so the United States can meet its own goals, because we're just sitting here waiting to give more. And I think that's why it's not always resources, it's resources linked with political will. And I think what we have an example of is amazing political will here in the United States that has sustained us for 30 World AIDS Day. And as Americans, we should be amazingly proud of that. Not that we're done, but I think we know what needs to be done.
Let's turn to a question over. I see none, so I'm going to ask you about one population that you focused on quite a lot, quite intensively recently, and that is a core focus of some of your recent work, adolescent girls and young women. How is it different reaching adolescent girls and young women in, say, sub-Saharan Africa versus here in the U.S.? Is there a different imperative? Are the populations different? Or do you find the same effectiveness in serving that population everywhere?
Well, young girls' experience are different, and they're different community by community, not even country by country, community by community. And I think we are extraordinarily so proud of Dreams. I mean, it's determined, resilient, empowered, AIDS-free, mentored, and safe young women. Why does it have that name? Because it means that you have to do all those things to be successful. What an amazing program to be able to listen to 15 to 24-year-olds and say, what is your journey? And how can we make your journey better so that you don't get HIV infected? You know, when we saved 2.4 million babies, those babies are now 15. We have a moral obligation to work with them to ensure that they get to 25 healthy. And I think it's an extraordinary program. As we announced, we continue, 85% of our districts continue to have declines. Is it perfect? No. And we will, every day we work on making it better, but it comes with listening to young women and to girls. And the other piece of this, and I just want to, so you say I'm always sunny, not when it comes to young women, the fact that we still have a third of 9 to 14-year-olds raped as their first sexual experience. This is the political will. These are the cultural issues. These are the things that we have to say in communities not acceptable. And I think where PEPFAR needs to have that voice that says to governments, communities, tribal leaders, the faith community, not acceptable. We cannot start young girls' lives with their first sexual experience being raped. So there is work yet to be done, but at least we can call that out. At least we can give voice to these 9 to 14-year-olds who very much have been voiceless for the last many decades.
My last question for you, in PEPFAR's new strategy for 2018 to 2020, you announced a focus on 13 countries, a more intensive focus on 13 specific countries. Why are you focusing the world's attention on these 13 at this time?
So we're looking at, it's kind of like fighting a fire. We were looking at, like with the fires that we had in North Carolina, we focused on where they were burning the hottest to put them out, and then we work around. So these are the countries that really have the most extraordinary pandemics, that we are making progress, but we're not going to accept a smoldering, continuous hotspots, reignition of a fire. And so we're really concentrating our efforts there. We're still investing in all the other countries in the same levels because of our congressional support, and really making sure that that money is being utilized effectively. But we believe in these 13 countries will create the roadmap for what it looks like, and to give people the hope, the scientific evidence of what control looks like.
Ambassador Birx, thank you once again so much.
Thank you, and thank you all for coming.
Thanks to all of you.